Muskoka District Health Unit reporting today about the status of COVID-19 in Simcoe, Muskoka. So to date, we currently have 151 confirmed cases. This is up by 10 from 2 days ago when I last reported. Of these, 62 have recovered, 11 are presently hospitalized, and we've had 8 deaths to date. If you look at the most recent cases, which, as I'd indicated, are 10. 3 of them are new cases among the residents of the Bradford Valley care community. And of these 3, 1 has actually gone on to be hospitalized. We are quite concerned indeed about that outbreak. We know that a number of those cases are now having fairly severe symptoms, so indeed we're monitoring closely, and although we certainly hope for the best, we do know that this is a dangerous virus that can hit elderly people very hard, and the potential for death in these situations is high. We've also, among our 10 cases, had 7 that are not related to that outbreak, and the age range among those is the teens through to the 80s. All of those are self-isolating. 2 of them have actually already recovered. There was a fair delay in the assessment and testing such that by the time we got to them, they were close to the end of the recovery period. Only 2 of the 10 were travel related, so the rest are either close contacts or part of that outbreak that is happening at Bradford Valley, or contracted in the community or under investigation. And that speaks to the shift that is happening. People coming into the country, certainly high risk for transmission for being cases, and they do need to go into home self-isolation as required by the Federal Quarantine Act for 14 days. But we also know there's transmission happening in our communities, and so people need to be exercising the physical distancing, thinking very carefully about when they go out, if you really need to go out, and when you do go out, keeping a distance of 2 meters from other people, avoiding crowds, hand washing on a frequent basis, and if you develop any symptoms, you need to be self-isolating in your home for a 14-day period and seeking medical attention if you fall into one of the groups that is considered to be a priority for testing. Although I've noted for quite a while that testing is highly desirable, and getting test results on people is highly desirable even if they don't fall into one of those groups, and that the ability of our laboratory system to do testing is greatly improved now, and our assessment centers, if they have room to test more people, it's helpful. And we do note that a number of these new cases that we're getting are not travel related. Majority aren't travel related. It's not apparent how they got it. They got it in the community. They're not particularly severe in their presentation. So these are people that sought out testing and got testing even though they didn't, for the most part, fall into the high-risk groups, and I think that's excellent. It's good to get results because it's good for our surveillance, it's good for us being able to follow up with people and helping to ensure they're in self-isolation. It's good for us to be able to follow up with their contacts, to put them into self-isolation, to flatten the curve, to reduce transmission in our communities so that we can dampen the surge that's happening and avoid overwhelming our healthcare system and avoiding very negative outcomes that could occur if our system gets overwhelmed. So if you look at our health stats page where we've got these cases listed, as I said, we have a total of 151 cases. 62 are now recovered, 11 are presently hospitalized, and I've indicated that we've had 8 deaths to date. There was a question last week about whether or not our case fatality rate is high compared with the provinces. And I indicated that we would have an answer to that today, so I have that answer. And that is that our case fatality rate, which is the number of those who are identified as cases, that are test positive as cases, what percentage have died. And for us, it is 5.3%. and for the province it is 3.9%. And when we do our calculation of statistical significance to determine whether or not that is definitely higher than the province, whether we could say with confidence that it's definitely higher than the province, the answer is no. We cannot say that it's definitely higher than the province. We do not have statistical significant difference between our rate and the province's rate. I'd be happy to answer questions about that when we get into the open session about questions. If you go back to our listing of cases and work your way down to the summary data, as always, it's the middle years that represent the largest number of cases, those 35 to 64. The next largest group is those 65 and above. Certainly of those who passed away, they've all been above the age of 70. If you look at the status of how these cases are being managed, 62 are recovered, 47 are in self-isolation, 22 are in isolation in a long-term care facility, Bradford Valley, 11 are presently hospitalized, 8 have deceased, and we've had 1 that moved out of area to the United Kingdom. And if you look at how they acquired their infection, 45 are travel-related, 33 are close contacts, 23 are close contacts as part of that long-term care facility outbreak, and 42 have been identified as community-acquired, with 6 under investigation. We also have a listing of the number of cases per lower-tier municipality, that does remind me to indicate that of our new 10 cases, we have 1 that is from the Muskoka area in Gravenhurst. So what I'm going to do now is go through a few items, a few things that points that I would like to make, and then address some questions that have been circulated in advance of this meeting. So I think it's very important for people to know that this is ongoing. This pandemic is continuing. Our present surge is continuing. It's still mounting. It's still increasing. We've not peaked as yet. And that people should think in terms of weeks for the present surge and for the whole pandemic to take place well into next year until we get a vaccine, waxing and waning over time, or increasing and decreasing over time. And what's really key in controlling it all is the physical distancing measures that people are participating in now, the location closures that the province has required with their orders. They've indicated that there's an extension of all of that, and this does include a number of outdoor amenities in parks and recreational areas, non-essential workplaces, public places such as bars and restaurants apart from takeout, and restrictions on social gatherings of more than 5 people. I always point out that even with the 5 people, you should really be, when it comes to intimate contact, sticking with those in your household and not bringing others, even family members, into your household, or coming in direct contact, or coming within 2 meters of them. It really takes that kind of discipline of us all to break that chain of transmission and to flatten the curve of the epidemic. And this is going to be required of us for some time to come. I do fully recognize how difficult this is on everybody, and personally I find it difficult myself, and particularly during holiday times it's difficult, and really want to emphasize the importance of people maintaining that distance physically while you maintain social contact through distance communication otherwise, and while you look out for people who are vulnerable, neighbors who need assistance with shopping for groceries, that type of thing, seniors, people who greater than 70. The chief medical officer of health of the province, David Williams, has recommended that they self-isolate for their own protection, so that means the rest of us need to be doing shopping for them and helping them out while keeping our physical distance from them. So, you know, it's important to know that although this affects the elderly most severely and those with pre-existing medical conditions most severely, there have been younger people that have been severely affected and hospitalized and in the intensive care unit or even ventilated. So it is important to know that we're all vulnerable. It's not just a matter of taking these measures to prevent transmission through you and beyond to others, but also for your own protection, protecting yourself, because none of us are invincible when it comes to this. The flip side of that is you can have cases that have very little or no symptoms, which means you're not safe if you have no symptoms. You could be transmitting to others. You need that physical distancing, and in particular, be aware of that when it comes to vulnerable people. There's been a number of people calling us with a concern that they see too many people in a grocery store at a time, groups of people, family members or household members going shopping. We urge people to choose one person to do this at a time, because that will make it easier for the physical distancing. It'll reduce the number of people that are in a grocery store at any one time, and it will reduce the number of people from your household who get exposed to the hazard of being out shopping and potentially being in contact with somebody that might transmit to you. If it's you alone, that's less of a risk than if there are several of you. There's more chance among the numbers that you have that could happen, and you can bring it into your home and then on to other people. So pick one person to do the shopping for your household, and I would suggest that it could be a policy of stores that they require that they limit entrance, one person per shopping cart per family per grouping that goes in at a time. I think that would be something that they should be considering doing, and that people also need to be mindful of the spacing requirements that have been set out in grocery stores. So many of them have done an excellent job with line management, with placing markers for spacing for people when they're waiting in line, and also having markers indicating the direction that you go down aisles. One-way aisles means you don't cross paths with people, which reduces the potential for transmission. All of that is really good, and I would encourage premises that haven't done that to go ahead and do that kind of thing. I think I'll go on to an update about the long-term care facility outbreak that remains, so Bradford Valley. They have a total of 6 staff that are positive and 23 residents that are positive. So we have 3 new cases. They're all in the residents, and so they contribute to the total of 23. As I said, we've had 1 resident pass away to date, and we have others that are quite severely ill, and 1 that's in a hospital right now. So we do work very closely with that facility. They do have all the control measures that are required in place. They are getting local support, including from South Lake Hospital, and the ability to draw for staffing as needed to help with that, make sure that they're able to operate well. And we're fully behind them in this, and we realize this is an extremely hard experience for those at that facility and anyone associated with it. Certainly they have my full sympathy and support. Going on to the media questions, there was a question about the clarification of the duplicate cases that we cited on Saturday when I spoke to the media last. So we, in our line listing up until Saturday, it turned out 2 cases that were duplicated in our line listing that we've removed from the line listing. So there was a question about exactly how did that work. So I'll go through the details. So there was a duplicate of what is presently, if you go to our line listing now, what is presently case 18 had been duplicated, and the duplicate has been removed. That one was previously called case number 89, so that's been removed. And incidentally, that case is recovered. And then there was a duplicate for case number 74, and the duplicate for that was number 90, which has been removed. And then all other cases after 88 have, because of the removals, have been shifted back. For example, what had been 93 is now 89. So hopefully all of that is clear. If you have any questions about that, we'd be happy to entertain them. So some questions that we got from the media are as follows, received earlier today. How does the health unit work with surrounding regional health units to prepare and compare? And I guess this would be management. I'll just have to go with what I've got written here to see if I understand the question. But if it's management of cases, we do on an ongoing basis communicate at a management level with other health units when there's a case that involves more than one health unit. If that person is from one health unit but had their exposure in another health unit, then both health units are involved in the investigation, both know about it. If there are contacts in more than one health unit, then we are communicating with the other health unit or health units about the follow-up with those contacts. And we're all putting our cases into the infectious disease database that we have, our Public Health Information System database. That is required of us to do so. We do so in a timely way, and the province gets that information so that the Chief MOH has that data in his reporting daily to the community. So hopefully that addresses your question. Do you use data from surrounding regions to predict what is going to happen here? And I would say that for the most part we're focusing on our data and also on what's happening provincially, the provincial reports, the provincial epidemiology reports. The province is on their website putting up their daily epidemiological summary, and it has a lot of good information in it, including the numbers of cases for each health unit and how that plays out as a rate of cases or incidence of cases per population size. So that information is available to us, and we do use it. And I would think that also there's a fair amount of email communication among MOHs if there's something new that has come up, if somebody has seen something new of concern, that they can raise it with others. And also I communicate directly with the Chief MOH if I have something of concern that I feel he needs to know. So with all of that, we get a sense as to what's happening everywhere, and that I think helps us with our communications today, for example, with the public about risk, the potential for, earlier on, the potential for community transmission in part would be driven by what I had heard of other health units and what they were experiencing even before we had evidence that it was happening here. All right, another one is just related to the same sort of thing. Is the caseload from regions nearby an indicator of what is coming for us with travel in our society? And this pandemic has been all about travel to begin with. Cases, all of it originated in Wuhan, China to begin with, but then migrated out through to person-to-person spread, and the travel that we have in the world today, it's all a function of that. So indeed, we've been watching very closely as this has rolled out what's been happening internationally, what's been happening in other countries, and then what's been happening about travel-related cases coming to Canada, to Ontario, what's been happening in British Columbia before Ontario, what control measures have been put in place in other provinces and other countries. There's a lot of comparing as to what the response has been and what the experience has been elsewhere. And I would say that that plays out also across this province as well, to help us in our overall response and give us a sense as to what's coming and what kind of alert we need to put out to the public. And for that matter, to healthcare providers. We do put out health faxes to our healthcare providers on our ongoing basis, updates with direction from the province and also information about our cases locally to give a heads up to our physicians and other healthcare providers in helping them look out for cases and manage cases. And we provide similar information from our municipalities and other stakeholders with updates. So final question here is, have you had any feedback from the assessment centers? Are they increasing testing now? So I will be able to give you a better answer to that on Wednesday. I don't have any data from the weekend that I can speak to on that, but we will look out for that, and I will give that information to you. I would say that what I'm seeing with, I do know that the province on the whole has much more capacity for testing. They have the ability to increase the amount of testing they're doing, but the Premier has made this a priority, and the criteria for testing has been broadened considerably, with much more of a focus on intensive testing in long-term care facilities to protect them as a vulnerable venue, a vulnerable population. But I've also seen test results come back recently on people that haven't been traveling, that are community acquired, that aren't in the priority groups for testing, such as, they're not healthcare workers, or they're not in long-term care facilities, and they're not first responders, and yet we're getting these results back. They're not severe cases, they're being not managed out of hospital with self-isolation, yet we're getting these results back. And to me, that's an indication that the assessment centers have, in practice, broadened their testing considerably and are now testing, I think, much more liberally, and I think that's a very good thing. I want personally to see results that reflect the risk in our community. We do want to be identifying cases so that we can follow up with them and ensure that they're in isolation, ensure that their contacts are in isolation, that they have the supports they need. So I think we're seeing indications that there's broader testing happening, and that is a very good thing. So that takes me through my notes, takes me through all of my items, and so at this point I'd be happy to take questions.
Okay, great. Erica, how about you?
Yes, thank you. On Saturday, or one of the last days anyway, the Oromadonte man who died, case number 44, is listed under investigation. You said you were going to look into that and find out more if you could.
Okay, so they've listed him as under investigation because his presentation was complex with a number of serious medical conditions, and I would say that that's the fundamental reason why he was left with that status. But I am comfortable with that individual being listed as a community-acquired case. So we may, in the very near future, be changing what we've got listed there for that person's designation. But now you have an explanation as to why it's been indicated as that, but also my sense that, in fact, it was community acquired.
Okay, well, Erica? Yes, please. Over the last couple of website updates, you've listed a couple of cases, like immediately as they've been listed as recovered.
Yep.
Collingwood number 122, Barrie number 151. I'm just wondering why, I guess, the delay in listing them. Did they not get tested until much later? Were we waiting on test results?
Thank you for the question. And indeed, they were delayed in getting tested, much more so than a delay in the results coming back. I don't have a detailed explanation for that, but I suspect it's because up until now there's been a focus on testing certain priority groups: healthcare workers, those with a severe presentation, those that work in long-term care facilities, people living in remote communities and First Nations communities. And so it's been harder for others to get tested. They might get assessed, but they were then told they weren't going to be tested. And that was because there was a backlog in the ability of the province to get the testing done, which they've now eliminated. There's no backlog. They're able to test many more people. So that, I believe, would be the explanation. It certainly would be the case for at least some of them.
Okay, thank you. Agatha, do you have a question? Agatha, you might be on mute. Okay, Adrian, how about you? Do you have a question?
No, I'm good right now.
Okay, Mandy?
Erica, actually, I answered my question.
Okay, great. How about Chris Simon?
Yes, just a quick question about the mortality rate. But what, Dr. Gardner, do we get to a point where there is statistical significance in Muskoka?
Thank you for the question. We may never get there if, in fact, our true rate is very close to being the province's. You know, if in fact we're very similar to the province, as the numbers go up. For us, it's true that you would get the ability to have what we call a confidence interval that's narrower, so we become more certain of the number, and our range of error, so to speak, or potential error, would narrow over time, but it may also be, and I don't see why it wouldn't be otherwise, that the number actually closes in on being very close to what the province's number is.
And second question, if you could talk about the community acquired cases. It looks like they've almost come up to par with travel-related cases. That doesn't surprise you at this point, does it?
It does not. I believe at this point in time the true number of community acquired cases would probably be much bigger than the number of travel-related cases as this transmits through the community. We do know that with surveillance we have the tip of the iceberg, that there are many other cases out there that we don't know about. Hopefully they've self-identified and put themselves into home self-isolation, although we also know that there'll be a number of those that have no symptoms at all, and they therefore won't be doing that, won't be able to do that. And that speaks to the importance, therefore, of everybody doing the physical distancing and assuming when you come across another person that they could have it and could transmit it to you. So I believe, I'm not surprised. I expect the proportion to shift going forward in time to be more and more in the way of community transmission as opposed to travel-related.
Okay, great. Dawn, do you have a question?
I do, please. Just looking for some clarification on case management, Dr. Gardner. When it crosses the bounds of two health units, in particular I'm thinking of seasonal residents who would have a primary residence somewhere else and one in Simcoe, Muskoka. How is that reported?
Well, so far we've included them. If they are here and they're staying here, we've included them as our own. And we've included for the location that's stipulated where they're staying, whether it's in a hospital or if it's self-isolation but in the community. And I've asked my staff to seek consistent clarification on that so that we're doing, between ourselves and other health units, comparable things or the same thing. So I've given you a sense as to how we're handling it now, but it may change.
Okay, thank you. And I do, just one quick clarification on that. So if someone became ill in Simcoe, Muskoka, but then returned to a primary residence, would that still be reported here, or would that go to whoever their primary health unit is?
We've had instances where they've moved out, and in one instance it was picked up by the press about Beaver Creek facility, for example, where there had been an individual that worked there that lives out of Simcoe, Muskoka, and we didn't include them in our line listing as a case because they moved back to where they came from. But I was able to speak to the press about the fact that we had identified contacts locally and that they were in self-isolation. We had one individual that moved back to the United Kingdom, and we indicated on our website them as case, but listed them as such. So I have to admit that there's been some back and forth variability in our own practice, and therefore I'm seeking that we clarify this for ourselves and become consistent, entirely consistent about it.
Okay, thank you.
You're welcome.
Okay. Doug Cross, do you have a question?
Yeah, well, pardon me. The instances of the movement we had over the past weekend, despite all the warnings, seemed like there was definitely more folks out and about in Simcoe, for example. Do you anticipate a bump in the numbers? And in what kind of time frame do you think we see that reaction of the increased contact?
Thank you for that question. That's a critical question. And I personally have seen a photo that was sent my way of a bunch of cars lined up to go boating on the Cray Lake. So we forward that on to the police, and we're seeking clarification about routine enforcement about such. I think that was a dangerous situation where any of those individuals could have exposed themselves to each other. The potential for transmission is certainly high, and that's just one that I know of. There could very well have been many others. So if we see a surge related to this, you'd see it probably 2 to 3 weeks out because of the incubation period and the time it takes for people then to get sick and seek medical attention and get tested, and then for us to get the result. You raise a critically important question. I thank you for it.
Yeah, it wouldn't be necessarily to our health unit because these might have been visitors, and now they're going to report back to their health unit.
That is true. That is all part of the problem. That's why we all need to take this seriously. And you know, the Premier has advised that we stay home unless we have to go out. I've said, well, you should be able to go out for physical activity very carefully, keeping your physical distance. But if we're not careful and we end up with a big surge, we might find ourselves in a total lockdown. It is possible.
Okay, excellent. Thank you.
You're welcome.
Okay, thanks, Doug. Agatha, we went around the first time and missed you. Are you there? Okay, I'm just going through my list here. Mike Arcidi, do you have a question?
Yeah, Doctor, good afternoon.
Good afternoon.
Walmart, over the weekend, that Saturday, everything opened up again and the floodgates opened up. There were people lined up outside the south end from the front doors all the way to Mapleview Drive. How concerning is that? That folks, when you ask people out there why they're going out, a lot of them are bored, and a lot of them are just, getting groceries as if it's, just an average Saturday. Unadvisable there?
Well, I think that for one, your point is well taken that people need to be selective about the shopping, and I'd already pointed out they need to do it like once a week, one person for the household, and maintain their physical distancing throughout and their hand washing throughout. The practices that we've got on our website right now about safe shopping. So line management is critical, and it's good that Walmart is limiting, and other facilities like it, limiting the number of people on their premises at any one time. But people also need to be physically distancing as they wait in line to get into premises such as Walmart. They need that 2-meter distance, at least a shopping cart apart from each other if they actually have a shopping cart in that line waiting to get in. I don't know if that was the case or not. And a lot of premises do a good job of taping off down the sidewalk, the distances apart. I think that kind of reminder is critical. I don't know if in that instance that was in place or not, but it needs to be if it isn't.
And with regard to other municipalities here, are we getting those reports that, were advised to come in if there were violators of either individuals or businesses that have been operating and shouldn't be? Have we, at the health unit, been seeing a rise in complaints?
I'm not aware of a rise of complaint about that. The complaint that I brought forward today came from our food safety department, where they received complaints, and that was with regards to people not spacing themselves properly and also going in large family groups as they go shopping. And so my message today being that you should pick one person from the household, and that they do it once a week and they maintain the spacing.
And just to reiterate, do you believe that a lockdown might be necessary if these rules and this advice is not followed?
It might be. If you don't get good compliance, and if we continue to see a surge, if it's evident that disease is not curbing, that we're not flattening the curve, it might prove to be necessary. That's, of course, the decision of the provincial government and the Premier during this time of a declared emergency. We shall see.
Thank you.
And is there anyone on the line who we've missed?
Yeah, James Bowler.
Oh, sorry, James. Go ahead.
That's okay. So Dr. Gardner, just in regards to the current infections, and my question is, if not for the public, but maybe at least for the emergency care workers that still have to go to grocery stores and shop, is there a possibility to start reporting on high-risk areas where people who were infected may have visited, talking about grocery stores, just to provide that level of information for people that may want to avoid that? I do want to point to hepatitis infections where you do name employees at restaurants, but I'm not just talking about employees, but anyone who may have visited these buildings when they were in an infectious state.
So, just to be clear, we almost never name an individual publicly. We do all that we can to give people information they need to protect themselves without violating privacy or confidentiality. The only time we would ever really, we don't name patients. We've named premises, certainly before, and that's when we deem there's no other way to approach people directly who've been exposed that have a high risk exposure. To date, we've only done that for one particular location. That was early on. That was at one of the hotels where a case had stayed and spent a lot of time in. And beyond that, we've been able to contact people directly who've been exposed for all of the cases. We've been able to avoid having to speak about locations. I have spoken of locations when they've come up in the media already, but that's, I would say, a different thing from us saying we need to go with that location for the public. And I think the important message for the public is you need to take a universal approach to this. You need to assume that there's risk everywhere, and therefore you need to exercise caution about going out at all. And when you do go out, the physical distancing of the 2 meters and the frequent hand washing and self-isolation if you develop symptoms, and avoiding crowds and respecting the province's restriction of no more than 5 people together. And I always say you should really only be intimately close with household members and otherwise maintaining that 2 meters. That is far more important for people to know, because we've already approached people directly when there's been a close contact, and to otherwise give locations means that people could easily assume they're safe elsewhere, and that is simply not a helpful assumption to make. It's much better to assume that you've got to be on your guard everywhere.
Okay, and in regards to the comment about grocery stores and only having one person go, you just say that, you suggest that these grocery stores adopt rules for that. At what point does it help you to actually step in and enforce that?
So we can only enforce that which is actually in regulation or law or directive, and only when we've been cited as being a party to enforce that. So at this point, there is no stipulation from the province that people have to shop individually. And so it'd really be a recommendation from me that they do so, and a recommendation from me that the food premises make it a policy that they can carry out for themselves to make that kind of restriction. And I'm also free to advise that the province might want to consider making that a requirement of food premises, that they only allow one person in at a time. But we don't have the ability to enforce that kind of thing now because it is not a regulation at this point.
Thank you.
You're welcome.
And is there anyone else on the line that I may have missed?
Kathy, this is Erica. I just noticed, Dr. Gardner, you said that you would report something on Wednesday. Are you still doing these calls daily during the week?
So we have shifted, we announced, I think it was Thursday, that we're shifting our approach, and now we're doing it Mondays, Wednesdays, and Fridays. This is based on my availability, and also because I think we're falling into some stability of messaging at this point. We will continue to provide the numbers every day, Monday to Friday, so you'll still be able to go and look at our health stats website to see the numbers of cases, but I would be available for media comment Monday, Wednesday, and Friday. Mondays, Wednesdays, and Fridays.
Thank you.
You're welcome.
Okay. And is there anyone else on the line we may have missed? Okay, thank you, everyone.
Goodbye, everybody.
Thank you.